Hi everyone, and welcome to another segment of the DL. So what I want to cover in this video is pretty basic, just the difference between X-ray and MRI. So normally when you go in to visit your doctor because you've been injured, you want to know what's actually going on inside the body, right? So most physicians will start with a physical exam just to kind of get a preliminary idea of what's going on, and they'll check with your history. And then the next step after that is to usually do an X-ray. So what this is doing is really, again, just looking inside the body to see what's going on. And what an X-ray does, so it uses radiation to differentiate between different pieces of anatomy. And X-rays really are only looking at bone because radiation, the level of radiation, I should say, that's used in X-rays passes through almost all types of tissue except for bone. So that's why everyone's pretty familiar with what a standard X-ray looks like. The bone is white, right? It's opaque, and everything else is pretty see-through. So this is commonly used to assess injuries like fractures or dislocations are very obvious on an X-ray. You can also see arthritis a little bit. So what arthritis looks like on an X-ray is instead of that very white, opaque, solid bone tissue, it looks, because arthritis is degeneration, so it looks like it's been worn away a little bit. So instead of having a very smooth edge of a bone that is very white and looks just pretty clear cut, the edge might be a little serrated, a little bumpy, and it's going to look more gray. So that's one way that arthritis can be seen on an X-ray. But it is pretty limited as far as what tissues you're looking at. This is really just looking at bone. What can be seen in an X-ray too is it could be indicative of another injury. So say you have a rotator cuff injury, there might be some displacement of the glenohumeral head in where it's supposed to be in the shoulder cuff and the acromion. So that can be kind of a preliminary diagnosis, but usually what's needed is an MRI. But the reason that X-ray is usually what's started with is you can rule out a lot of things, or if it is a fracture, you can stop at X-ray and not have to do any further screening techniques. And X-ray is a cheaper option, so it's usually the best place to start. So an MRI is looking at more tissues. So it uses magnetic resonance imaging. That's what MRI stands for, specifically with radio waves. And what you can see in an MRI are organs, soft tissues, bone, internal organs. So you really can see all the different types of body parts inside. So also, an MRI really takes slices of images, so it can be a sequence, whereas an X-ray is just one flat image, right? You're not seeing different planes within the body, whereas MRI, you actually, when you're looking at one, you have to look at it on a computer. So you start, like, say I'm taking an MRI of the shoulder joint, right? It would start here, and as I would scroll through images, it would take me on slices closer and closer this way, or it could go this way, any plane in the body. But essentially you can see the changes going across it's more of a 3D visualization. So again, you can see more types of tissues, and really this is used to look for abnormal versus normal tissue. So if there is a tendon tear or a ligament tear, that's when you're going to need to use an MRI to see those kinds of injuries. So really, if it's something other than a bone fracture, you're probably going to have to get an MRI. They're usually covered by insurance. It depends. The only downside to an MRI is you are in a pretty enclosed space, and that makes a lot of people nervous. So that's just one thing to think about. But again, usually pretty necessary. The doctor will standardly start with an X-ray. And if it is not just a plain bone injury and there are soft tissues like tendons, ligaments, and muscles involved, you are going to have to get an MRI. So hopefully that answered some of your questions as far as radiological techniques, and thanks for watching.